So as an osteopathic physician, I can't have an osteopathic presentation without giving our founder, A.T. Still. This is a quintessential picture of Still. Late 1800s, he really wondered, why is it that the human body can't heal itself? And what can we do to help the body heal itself? When you remove dysfunction, somatic dysfunction, when you remove barriers, you get the arteries, you get the vessels, you get the lymphatics, you get the nerves running to tissues, you get waste and whatnot coming from tissues. When the body works well, it should be able to heal itself in many ways. So in the late 1800s, PCOM is just celebrating its 125th anniversary, for example, this year. So I thought this quote was pretty powerful, and it's something that centers a lot of the integrative medicines, right? We look at the body in health as meaning perfection and harmony, not in one part, but in the whole. And so, as an osteopathic physician, I am assessing patients' bodies from their feet all the way to their head. I'm looking with my eyes, thinking with my mind, feeling with my heart, and really assessing, okay, where does your body move? How does it move? Like I said, you come in with right shoulder pain, I'm still gonna start at the feet because our feet are our foundation. How many times do I get up and move and such, right? Our feet are how we carry us. So looking at the body, using the hands, feeling layer by layer your body and seeing what is moving, what is not moving. And how does this connect to the nervous system? We are nervous systems experiencing the world, right? Our bodies have an innate intelligence of being able to sense the world, interpret that outside world and inside world, right? And so pulling that all together, as a DO, what I'm doing is I'm removing restrictions in the body, allowing your body to move in a way so that it can realize its health. There are many different modalities that tap into this same, existence, right? Acupuncture does a number of things as well. There are a number of other modalities, and ultimately it comes to what fits best for you, all right? So a lot of times when we remove the restrictions in the body, we get somatic, meaning of the body, soma, visceral, of the organs, and emotional release. So again, some of the conditions that we treat using biomechanical, sometimes it can be very, move this muscle to move this bone, right? Very biomechanical dysfunctions. Visceral of the organs, and cranial-sacral osteopathy techniques, right? We can treat acute or chronic conditions. You come in, you're running this morning, twisted your ankle. Okay, well that's a really biomechanical, assessment and treatment. Other chronic things, stress and anxiety. Who experiences stress? Who feels it in your body in a place, right? I absolutely love teaching patients connect with that space and feel what it feels like and how can we release it. So as a physician, I also really take it to heart that a huge part of my role is teacher. And so working together, I am removing barriers, I'm removing restrictions. Your body and the health of your body is doing the work. So some other conditions, migraines, headaches, TMJ issues, one of my favorite things to treat. And then even, IBS, constipation, the link between IBS and anxiety, hypermobility, right? If your body is hypermobile, it's constantly trying to find that stable point, right? If it's hypermobile, then a lot of times pain syndromes come from that because, again, we like stability, we like to know where we are in the world, right? Our nervous system likes it and our conscious mind likes it as well. Fibromyalgia, low back pain, you guys can continue to read on. And yes, OMM from birth to 100 plus.